SARS started as an unknown illness without name, origin, or cure. The first case of SARS identified was on 16th November 2002 in Guangdong, China. It was identified to be a case of atypical pneumonia. On 11th February 2003, the World Health Organization received reports from the Chinese Ministry of Health of an outbreak of acute respiratory syndrome, with 305 cases and 5 deaths in Guangdong province. By this time, SARS was already carried out of Guangdong province. On 21st February 2003, Liu Jianlun, a 64-year-old Chinese doctor who had treated cases in Guangdong, traveled to Hong Kong and checked into the 9th floor of the Metropole Hotel. From there, SARS spread to Toronto, Ottawa, San Francisco, Ulaanbaatar, Manila, Singapore, Taiwan, China, and Inner Mongolia. When the WHO caught wind of this new disease, they swung into action. On March 12, the WHO issued a global alert about a new infectious disease of unknown origin in both Vietnam and Hong Kong. On March 15, the WHO issued a heightened global health alert about a mysterious pneumonia after cases in Singapore and Canada were also identified. This alert included a rare emergency travel advisory to international travelers, healthcare professionals, and health authorities. On April 16, the WHO issued an official press statement with the details and official name of the virus, SARS. By this time, SARS had already spread to Singapore. On the 1st of March 2003, patient number 1 was admitted to Tan Tock Seng Hospital for suspected pneumonia. She and 2 other women fell ill after visiting Hong Kong. 2 of them were admitted to Tan Tock Seng Hospital, while the 3rd was admitted to Singapore General Hospital. She stayed at Ward 5A and went on to infect 22 people, 10 of whom were healthcare workers. One of the healthcare workers infected sparked off a second super spreading event within Tan Tock Seng Hospital and infected another 21 people. One of these people was transferred to Tan Tock Seng Hospital's coronary care unit and catalyzed the 3rd super spreading event. The 4th super spreading event took place after a patient from Ward 5A was discharged with undetected SARS and later readmitted to Singapore General Hospital. He infected 30 people, including his brother, who was a vegetable wholesaler at Pasir Panjang Wholesale Market, caused the 5th and final super spreading event, resulting in the market's closure for 10 days. At first, a SARS patient might feel fatigue, headaches, fever, lethargy, confusion, rash, loss of appetite, muscle ache, chills, or diarrhea. From 3 to 7 days after exposure, respiratory symptoms develop as infection spreads to the airways and lungs and may include a dry cough, runny nose, sore throat, shortness of breath, gradual fall in blood oxygen levels, and pneumonia. Apart from the death and suffering SARS brought to its victims, SARS also had many other effects. Hotels, restaurants, retailers, airlines, travel agencies, and taxi operators were among the most affected industries. Things were not looking good. Something had to be done, and something was done.